Hey, I'm Jana Kramer. I am 38 years old. I'm a mom, singer, actress, podcaster, winemaker, author, and anything else you want me to be. Dr. Unger.
Well, that's hard to follow. Hi, everyone. I am Dr. Jacob Unger, and I am also 38 years old.
Ooh.
And I'm a board-certified plastic surgeon, and I own National Plastic Surgery Institute at Maxwell Aesthetics. I'm a father of 3, and I was honored to take care of Ms. Jana Kramer.
So when I started my breast augmentation journey, I wanted to make sure I obviously had the best doctor do my augmentation, and I had heard some amazing things about Dr. Unger. And when I met him, I just knew he was the doctor for me. How we got along, how comfortable he made me feel. He answered every single one of my questions, and there was quite a few. So I just felt really, I felt like I for sure knew I went to the right place. So the initial consultation with Dr. Unger was fun. It was kind of like I got to dream up like what I wanted to feel and look like. And Dr. Unger showed me the Natrelle implants, which you said that those are the only implants you use, right?
They are.
And he also said, backed it with all the research and knowledge behind the Natrelle implants, made me feel comfortable. You made me feel, how many implants did you let me feel? Like low, high?
So we talked about various variables that exist within the Natrelle line, and why I really like the Natrelle implant. We have different cohesivities, meaning different firmnesses to the gels. So I like to match the appropriate gel firmness with the right patient, as well as profiles, meaning the projection. And I love the fact that each implant is wider by 1 to 2 millimeters, so I can really kind of hone in and nail down that sizing for each patient. So in the initial consultation, Jana's concerns and goals, I think, were really similar to most women's. Each woman has their individual desires, and hers were really to have a subtle but elegant enhancement of her breasts, good shape overall, good balance. And so what I really try to accomplish in that initial consultation is distill down patients' goals and desires by understanding where they're coming from, what they're looking to achieve. And then I use Natrelle's very extensive line of products to really finesse and hone in on the correct implant to help create that shape and look and feel that each patient is looking for.
Yeah, I would say the only concerns that I had were just from things that I had read online, people talking about certain things that could potentially be wrong with implants or certain studies, and you made me feel very confident with the research and the science behind all of it. I thought it was really cool during our consultation that he was actually able to take a photo of my breast and my torso area and then be like, okay, this is what size you can be here. So this is a smaller implant, there's a little bit bigger, there's a bigger. And just sit there in your office and go, oh my gosh, like look how big my boobs could be. Or like, oh, maybe those are actually a little too small. But we could really have a conversation of and you could get like what I like and what I don't like and kind of the idea image of what I was going for. I thought that was pretty neat.
Yeah, I'm glad you enjoyed that process. And I really love when I am consulting with a patient and understanding their goals and desires, I really use the imaging process to help ensure that we're on the same page. You have to understand what the patient's goals and desires are and where they're coming from. But at the end of the day, I feel it's incumbent upon me as the expert and the surgeon to determine the appropriate implant to give that goal. So I always tell my patients, the CCs don't matter. We don't get into that until the very end. What matters is that we're creating the shape and the appropriate contours that you're looking for.
I chose Natrelle because I chose Dr. Unger, and Dr. Unger spoke very highly of Natrelle, and again backed it up with the years of science and research and the amount of years that they've also been using Natrelle too. So I think that made me feel very confident. And then to be able to feel in the office too, to be able to feel the implants and get the okay, this is what's gonna be going in my body. But you made me very comfortable about Natrelle because you have a lot of options to choose from, I can imagine. Hundreds, right?
Hundreds, yeah. Natrelle allows us to have literally hundreds of options. And I really love the fact that there are various gel firmnesses very, very narrowly spaced dimensions for each given size and size range that allow me to really fine tune the result. But if you want to really get into the science of it all, which is where my background of course is, I love the safety and efficacy data that exists with that implant line. I've used every brand in the United States and then even some through clinical trials that are not in the United States. And I have just found consistency in the product. I like the support that the company provides both patients and physicians. And I just really feel confident knowing that it has a very, very strong safety profile.
I love that.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.